Hi Tori, my name is Dr. B. Nice to see you today. I'm going to be doing a cranial nerve exam on you, okay?
Okay, sounds good.
So before I get started, I'm just going to ask you some general health questions. Are you in any pain today?
No.
Okay, so if I gave you a scale from 1 to 10, with 1 being no pain and 10 being excruciating pain, you would be at about?
A 1.
Perfect, okay. And have you ever had any issues with your vision? Do you wear glasses or contacts?
No.
No, okay, so you can see far nearsighted, okay. And what about any issues with your nose? Any smelling issues? Any issues breathing in or out?
Nope.
No, okay. And any issues with taste in your mouth? Any pain, sores?
No.
Okay. Any issues with your hearing? Can you hear the same on one side and the other?
Yes.
Perfect, okay. So generally it seems like your health is good. We're just going to go through and test all of your cranial nerves and a few of your reflexes and neurological type things to make sure that everything's in order. And we'll just address anything that pops up. So any pain or discomfort along the way, just stop me and let me know, all right?
Okay. Thank you.
Let's start out just getting your blood pressure. Do you have an arm preference? Perfect.
Do you want me to roll my sleeve up?
Or you can just leave it down like that. And just Is that okay right there? Okay. Okay, just stop me if you're in any discomfort. Okay, good. So you're 117 over 70. That's perfect.
Thank you.
I'm just gonna put on some gloves. Is it okay if I touch you?
Yes.
Okay, I'm just gonna go ahead and feel your head. Any lumps, bumps, pain, tenderness, anything? Does that hurt at all? No? I'll just check a few areas here. No redness, swelling. Okay. Now just take a look at your skin. It's nice and even. Warm to the touch and dry. Everything looks nice and symmetrical. Do you have any pain when I touch here?
No.
What about right here?
No.
Okay, perfect. Just checking your ears. We'll take a closer look at those in just a second. Your eyebrows look good. Eyelashes are nice and distributed. Lips look even and not too dry or cracked. Okay. You go ahead and push on my hand right there. Perfect. And just move your head and back like that against my hand. And to the side. And again to the side. Okay, that's good cranial nerves intact there. So you can go ahead and just take a look into your eyes. I'm just going to be using a bit of a light. I just want you to look past my shoulder and just ignore me, okay? I'm just looking for the eyes reacting, and they do. Perfect. You take a look at this tip of my pen, just follow it everywhere it goes. Any double vision here?
Maybe a little bit.
A little bit? Okay. What if I do it right here? Is that any better?
Same thing.
Same thing, a little double. Okay.
Yeah.
Go ahead and look at the tip of the pen right here.
Okay.
Ignore my finger. And can you look at my finger? Good. And look back at the pen. Okay. Any issues there? Any straining in the eyes?
Not at the moment, no.
Okay.
Thank you.
I'm just going to take a little bit of a closer look because you did have that little bit of double vision there. just look straight over my shoulder. And apologies for getting a little close here. So I would say if that double vision continues, to just go see an optometrist and get a full workup. But everything looks okay, looks intact. I can see the red blood vessels just fine. Go ahead and do a little bit of a nearsighted eye test here. So go ahead and hold this just about there. And can you read this line for me right there?
O-L-C-F.
Great. And can you cover one eye? Choose whichever side you choose. And just read the same line backwards.
F-C-L-O.
And then cover the other eye. And can you read it forwards?
O-L-C-F.
Perfect. Actually, go ahead and use this, cover one of your eyes. I'm just going to test your peripheral vision. So I want you to stare straight at my nose and tell me when you see my fingers come into your view, okay?
Okay. Okay, yes. Yes.
Perfect.
Yes.
Good.
Yes.
Okay, switch eyes for me. And look straight at my nose.
Yes. 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 Yes.
Perfect. Okay. Good. The last little eye thing we're going to do is just check for your color. Just have a little color chart here. Okay, can you tell me what this color is?
Green.
And what about this color at the top?
Red.
Okay, and this bottom color?
Yellow.
Perfect. So that's fully intact. I'm just going to take a look at your nose. And you said no problems with stuffiness or dryness in your nose?
I have had quite a lot during the winter season.
Okay. Is that normal for you?
Not particularly. I feel like the weather has been really dry, but I do have really bad allergies too, so it's probably related.
Could be, yeah. Let me take a look. Just going to gently tip your head back for me. A little bit of redness and swelling for sure. Not seeing any discoloration. Not an excess of buildup or anything like that. Can you breathe in here for me? Okay, on this side. Okay, a little occluded on this side. Is it painful at all when I do that?
No.
Okay. I'm not too concerned. You can try some over-the-counter medication, some daily allergy medication. Because you do have, a little bit of redness and swelling in there, and that discomfort, if it gets worse, I would probably want to take a closer look and maybe do a scan for any sort of sinus infection or anything like that, okay? And while I have this out, just open your mouth for me real quickly. So you say, ah. Let me check for my light. Okay, everything looks good. Can you, with your tongue, the inside of your mouth, press against my hand? Good, nice and strong. And on this side. And can you puff your cheeks out? Good. This side for now. Just going to give you something to smell. Go ahead and close your eyes for me. And cover one nostril. Can you tell me what that smells like?
Coffee?
Perfect. And cover the other side for me. And you recognize that smell at all?
It smells like garlic.
Yeah, perfect. You got them both. Alright. I'm going to make my way to your hearing. And you said no issues hearing or anything like that?
No.
Okay. Just going to check inside your ear. Move your hair for a second. And I do see a little bit of redness and swelling discharge in there as well. That could be related to the allergies, the same. Let's check on this side. And same in there. Yeah, not too concerned, but there's definitely a little bit of redness. Do you ever get itchiness in your ears at all?
Yes, during allergy season,
Okay.
I do as well.
That makes sense.
Yeah.
So, any pain or tenderness when I press in there like that?
No.
Over on this side, any pain or tenderness?
No.
Nothing along this part?
No.
Let's do some hearing tests. Got this tuning fork. I'm going to hit it. I'm going to put it right in the middle of your head. Just tell me if you hear it left, right, or the same.
Okay. Right.
Okay, try one more time.
Oh, nothing. Oh, right again.
Okay, so on that side, or on that side? Okay. And I'm going to do the same thing. I'm going to hit this. I'm going to put it on the back of your ear. Tell me when you can't hear it anymore.
Okay, I can't hear it.
What about here? Can you still hear it?
Yes.
Perfect. I'm going to do the same thing on the other side. Tell me when you can't hear it anymore.
Okay, I can.
Can you hear it here?
Yes.
Perfect. Okay. So in theory, you should really hear more the center of both ears. So, but again, there's a little bit of swelling in this ear, so that can be one of the causes of that. I do think after that over-the-counter allergy medication, that would swelling would go down and the hearing would even out on both sides.
Okay.
But we'll get back into that if that doesn't change. All right. I'm gonna do a little bit of neurological on your face now and on your upper body. So. First thing I want to start out with is having you make a couple of faces. So can you smile for me? And frown? And lift your eyebrows up? Perfect, nice and even. Okay, can you close your eyes and don't let me open them? Good. Can you keep your jaw closed against my hand? Good. I want you to shrug your shoulders. Nice and strong, very good. Put your arms up like this and don't let me pull them. Good, and now don't let me push them. Okay. Hands up like this, don't let me pull them back, and don't let me push them. Okay, do the same thing with just your thumbs now. Good, okay. I'm going to do some reflexes on you. We're almost done, thanks for bearing with me. Just go nice and loose for me, okay? Good. Good. Okay, and on the side. Nice and loose. Give me all your weight. Good. Okay. I'm going to do some sharp and dull sensation. So I've got this little tiny, if you put your hand out, sort of like soft. Like that, okay? And then this pin is a little bit sharper, but it's not going to pierce the skin, okay? So I'm just going to have you pull up your sleeves just a little bit. And close your eyes and tell me sharp or dull.
Dull.
Good.
Sharp. Dull. Dull. Sharp. Sharp.
Yep. Good.
Dull. Dull.
Good. Now I'm just going to touch your face with a real light cotton pad here. And I just want you to tell me if you feel it.
Okay.
So it's just this, okay? Tell me yes when you feel it.
Yes. 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 Yes.
Very good. Alright, I think we're nearly done. Let me just take one last general look. I'm going to go ahead and do some, there was a couple of missed things with the neurological, so go ahead and put your hands out for me. I'm going to draw a number in your hand facing you. Close your eyes and tell me what I'm drawing.
3.
Perfect. And I'm going to do one in this hand as well.
7.
Great. Now would you go ahead and put every finger like this? Good. Perfect. And can you clap your hands? And a little faster. Good. Okay. So everything was all good there. I think that we look pretty good for the day, Tori. So do you have any questions for me?
No, I don't think so.
Okay. So basically, I think what I'd suggest to you is just you know, I think the eyes and the ears may all be related to those allergies and being a little stuffed up and your sinuses being a little bit pressured. So go ahead and try some over-the-counter allergy medication for 60 days, and we'll have you come back and we'll do the exam again to make sure that those things have cleared up, okay?
Okay, thank you.
All right, thanks for coming in.
Of course, thank you.